And he would still be saying to the church and other people, you're not doing anything to improve that. Because our science is ahead of everything. It's ahead of our ethics and our theology and our sociology and our anthropology. And what we need are scientists with a moral compass to try to pull these other things, up to the equal of science. So we don't have great arbiters of trying to get a moral compass into science. The social contract that most of us grew up with, you do certain things and you expect other people to do certain things. The social contract has broken down a lot. It's one of the problems we have with vaccine use in this country. And when we see children getting measles, and they shouldn't be getting measles, and measles is a severe disease for some. When we first went to live in Africa, 7% of all children in Nigeria, where we went, 7% of all children born died of measles. That's how severe that disease can be. And now we see children being exposed to it. And we know that children who don't die, some of them actually are mentally retarded because of measles. And I've often had the thought that maybe that goes through the whole bell-shaped curve, that maybe people my age that had measles may have lost 4 or 5 IQ points. And so that the measles impact is great. And then we have these children who are now getting measles because parents are opposed to vaccination. And my approach to parents opposed to vaccination is not one of anger. They are not trying to hurt their children. I can tell you that they're doing this because they absolutely believe that the vaccine may be dangerous to their child. And the problem that comes up repeatedly, they worry about autism. And autism is a totally made up, it's a fictitious part of the whole story. It comes from a fellow by the name of Andrew Wakefield, who published a paper in Lancet, raising the probability or the possibility that measles, mumps, rubella vaccine was actually causing autism. He had, I can't remember, but I think 12 children in his study that he reported on. And he came up with a theory of how this was happening. And of course, this scared parents. And the British Medical Society then investigated him, and they found the children that he had in his paper, some of them did not even have what he was saying they had, but they came to the conclusion that it was not an authentic paper. He lost his license to practice in the UK. And it turned out he was getting money from a lawyer that had a case against a vaccine company. Now that's a small story in the scheme of things, except that it exploded around the world. And with autism on the increase, there are so many parents with an autistic child who want an answer. They want to know why their child has autism, and they latched onto this. Well, Wakefield, when he lost his license in the UK, came to the United States, and he still goes around giving talks, and he gives talks to parents who believe him that their children are autistic because of vaccine. There have, on the one hand, been now studies with millions of children showing there's no difference in the autism rate between children getting vaccinated and not getting vaccinated. On the other hand, there's so much research now on autism that we can be reasonably certain whatever's causing it is probably during the second trimester of pregnancy. So it's not something after birth that a child is subjected to. We don't know what it is, but there are many possibilities of chemical agents and so forth that are causing this during the second trimester. But that has now led to a anti-vaccination group in this country. They become stronger every year. And it's because of this that we now have measles coming back to the United States and other childhood infectious diseases. And as I say, I do not get angry at those parents. They are simply misinformed. And it's not the government that's going to change their mind on this. I mean, if they believe that, they're not going to trust the government to change their mind. I used to live on Vashon Island in Puget Sound. They had one of the poorest immunization records, and they actually ended up on the front page of the New York Times. Their children with no vaccinations, I think, were about 18 or 19%. Now, if you know Vashon Island, these are the hippies of the 50s that started there. Very anti-government in many ways, and they continue. It's a great place to live, but it's a place that does not like government interfering. So the government is not going to come in and change their mind. But what started to change their mind in Puget Sound, a couple, they'd both been Peace Corps volunteers, and they believed in immunization, and they started asking the parents who did not believe in immunization, why don't you? What would it take to change your mind? What kind of information do you need? Well, they've been able at the grassroots level to bring that non-vaccination level from about 18 or 19% down to about 12%, and it's continuing to fall. This has to be a grassroots effort. It can't be a government down effort. But I tell obstetricians, you could certainly help this is if you said to every pregnant woman, you do not have to worry about your child having rubella syndrome. Why? Because other children have been immunized against rubella and stopped the transmission of that virus in this country. So they have given part of the social contract. Those children vaccinated, there's no advantage to them because it's rubella syndrome in the womb that causes the problem. It's not rubella after you're born. So they contributed to the social contract and then asked the mother, what are you willing to do to repay all those children that protected your child? I think that's the way to get across that there is a social contract involved. And it's very easy now for parents to say, there's essentially no risk of the disease, but there is a risk for the vaccine. And so you can see how they would reach that conclusion. In a perfect world, I would like to do that. Not take any risk from the vaccine and take no risk from the vaccine and have other people protect me from the risk of the disease. It seems like a reasonable thing to do. It doesn't work that way. The diseases come back, except for smallpox. It's the only one that's been totally eradicated from the world. So what are the challenges? Well, one of them is the one I start with, that we have to see that science does not have a social conscience. It does not have a moral compass. And this is true with nuclear weapons. It's true with genetics. It's true with everything, gene cutting. And we have to go back to the social contract. We can't rely on the marketplace to get us out of this. There are people that believe the marketplace is the answer to everything. All you have to do is realize today in the United States, there will be between 4,000 and 5,000 deaths. And even though we've had such an impact on smoking, 1,000 of those deaths will still be due to tobacco because of the past history. So the marketplace was not going to solve the tobacco problem. All it did was to make it worse. And the H1N1 flu, when that came up, Ron Paul said, this problem is so complicated, we should take it away from the public health people and give it to the marketplace. Can you imagine what the marketplace would have done for H1N1 flu? So the marketplace is not the answer for everything. It's a great place to get answers for many things, but not for everything. And part of public health is to monitor and know when the marketplace is being harmful so you can do something about it. Now back to the coronavirus. So we were asked in July by the NIH and the CDC, they asked, could we get the opinion of a group outside of government on how we should distribute and allocate vaccine when it becomes available. So they went to the National Academy of Medicine. The National Academies were started by Abraham Lincoln. So over 150 years ago, he said, we need a place outside of government where we can get an objective opinion on science. And it's gone ever since then. So this is now a report that came out today from outside of government saying this is what we think should be done. We looked at who gets the coronavirus, who's at risk, who gets sick from it, who ends up being hospitalized, who ends up dying, who ends up spreading it to other people. And we said everyone's equal, but not all positions and jobs are equal. Therefore, some people have to be protected because they protect people downstream. You have to protect the people who are working in emergency rooms because you need a functioning healthcare system, not just for the coronavirus, but for all the other things happening. So we have a first phase, a kickstart group of the medical people. And when we talk about medical people, we're not just talking about doctors and nurses. We're talking about the janitors and everyone working in that building that could be exposed to the coronavirus. But that group and the first responders are the first group we go to. I was so pleased with the way the report came out on many things. For instance, everyone expected that we would have two categories at highest risk and therefore highest priority: old people and minorities. With minorities, we looked at this and we said, you know, the problem is not race. The problem is racism. And so we asked, what are the risks that are so much greater for minorities? Well, they turn out to be both personal and social risks. Personal risks have to do with the comorbidities. And there's a long list of them, but there are three of them that are outstanding. If you've had heart failure, if you've had kidney failure, if you have a body mass index of over 40, those three just stand out as being such big risks. Then there are the social risks of living in crowded conditions, living with multi-generations in one house, living in a place where you can not work from home, having to go out and actually be exposed to the virus every day, having other people who go out and then bring it back. And so we said, if you look at those risks, both the personal and the social risks, and you make those priorities, this virus cannot detect skin color at all. And so you don't start with saying minorities should be first in line. And on this committee of 18 people, I haven't even counted up, but many of them were minorities, including American Indians, Blacks, Latinos, and so forth. And they were just delighted by this approach that did not say minorities are a problem, race is not a problem, but racism is. The other thing with age, it turns out the models show you can prevent more deaths by using limited vaccine on the workers in nursing homes rather than the residents of nursing homes. So if you have a real shortage of vaccine, you have to do things like that. My feeling is that the vaccine will be in short supply to start with. And then once it starts becoming available, it's going to come so fast that the whole population will have access if they want. But the people who will benefit the most from vaccine are the minorities, and they're the ones with the most hesitancy. And if you are a minority and someone says you can be first in line, your first response could well be, but what have you ever done for me in the past? Why are you putting me first in line now? You want me to be a guinea pig. You want me to demonstrate whether this is safe or not. So I can see the hesitancy, and it's going to be hard to get beyond that hesitancy. It's going to take some real some real work. So the problems that we saw right from the beginning of how do you take care of all these uncertainties, they're just going to continue. We have 149 vaccines in some phase of development around the world. Think of that, 149 vaccines. 4 of them now are in phase 3 trials. 2 of them are going to be very difficult to deal with, even if they're good, because they have to be kept at minus 80 degrees centigrade. So this is over minus 100 degrees Fahrenheit. And there aren't many places that can keep things that cold. There aren't many ways of shipping things that cold. So it's not going to be easy to use those vaccines, and they will have to be used at medical facilities that can actually handle that kind of temperature. One of the vaccines is looking at a single dose. The other 3 are looking at 2 doses. The one with a single dose will only require refrigeration, won't require freezing. And so it will be much more like vaccines of the past and easier to use. But now, again, more uncertainty. What happens if 2 vaccines come on the market and we start using it with the framework that we developed, and now comes a 3rd vaccine that's even better, requires only refrigeration, and only requires 1 dose? What do you do with the people that have already started the series with the other vaccines? How do we know what the protection will be in different age groups? All the phase 3 studies, by the way, exclude children under 18. So even when the vaccine comes out, we don't know how good it will be in children under 18. I'm 84. We don't know how good it'll be for my age group. And we're getting some clues now on phase 2 studies that show people my age do get good antibody response, but we don't know if they have good protection from the virus, the disease in general. So you can see all of the uncertainties that we're dealing with. The other thing that totally surprises the people that were not expecting this, they thought we would somehow punt on the global responsibility. And particularly since the White House has now taken us out of membership with WHO and the World Health Organization, they assumed we would not want to respond to this part of the charge. But we, again, took this on head on, and we said this is a global pandemic. We truly are all in this together. And what would happen if it turns out that none of our vaccines worked, but the Oxford vaccine, other vaccines do work, and we have to go on the world market to buy the vaccine? If we've already said we don't want to be part of the global effort, it's going to be very hard to turn around and get people to sell us vaccine. The other thing is we need the rest of the world to continue sending us specimens so we can keep track of any change in the virus. We don't expect a big change, but we could have, as with flu viruses, a change where the vaccine is no longer protective. And so we have to be part of the world community. Furthermore, the single best group in the world in delivering vaccines now is something called Gavi, Global Alliance for Vaccines and Immunization. This is very much a US program. It was started by Bill and Melinda Gates, who put up $750 million 20 years ago to start it. And after 4 years, I was so worried that they would not renew their pledge because they were disappointed. They had expected other people to join in, and they didn't. But Bill and Melinda Gates decided we're going to continue, and they put in another $750 million to continue this. And just as I had hoped, the rest of the world now saw they were in this for the long run, not just the short run. And the day after they put in their second $750 million, Norway pledged $250 million, and the UK pledged $1 billion for the Global Alliance for Vaccines and Immunization. This program now has experience running programs around the world. They're in charge of the global consortium that's looking at how this should be distributed in the world. What's an equitable distribution in the world, and who should be vaccinated first in each country, and so on. So our committee said, right from the beginning, we should say this is part of a global effort, and that we will give 10% of the vaccine we produce right from the beginning to the Gavi program, so that it's a global contribution. I think we've already used our time for talking. In fact, I've gone over, and I apologize for that. So let me stop and take questions for whatever else you want to know about the coronavirus.
Thank you, Dr. Foege. So if you have a question, down in the, if you click on participants on the bottom, and then a screen will show up on the right, and there's a raise hand there, and that will help me to know if you have a question, and then I will ask you to unmute. I'll give you permission to unmute. So we'll do it that way. There we go. Libby and Charles.
Yes, Dr. Foege, thank you very much. That was really a brilliant short talk that you gave us. My question is the problem of government leaders citing other science sources when they disagree with the major science sources. For example, President Trump talking about forest management. You know, that's the problem of fires. And we have in our own state the example of our Governor Kim Reynolds, who refuses to issue a mask mandate because she says there's other evidence that says that masks don't work. And so that seems to be a real problem of discrediting science when someone else says, well, there are other scientists that disagree, and suddenly there's doubt instead of certainty.
Yeah, it's a real problem, and it's part of the hesitancy you see now. A large percentage of Americans say they will not take coronavirus vaccine when it's available. An even larger percentage of minorities say they won't because they don't trust the government. And science usually works these things out, because if someone says, but other scientists say this, all you have to do is ask them, show what they say. And then you come up with a group that looks at a meta-analysis and comes up with a conclusion. And the certainty of science, uncertainty of science is so important, because science knows that even if we look at this, it may not be true. I quoted Richard Feynman saying certainty is the Achilles heel of science. And one of the illustrations he gives that I really like, he was shaving one morning, and here's the second most brilliant physicist after Albert Einstein. He's shaving one morning, and suddenly it strikes him that the explanation physicists have given forever on why left and right are reversed in the mirror couldn't possibly be true, or top and bottom would be reversed. And he said, science has been so certain, and it's just not true. And so he worked out finally, I mean, he worked on this for a long time. He worked out what happens when you look in the mirror. So that's the way science works. Is if something's wrong, then they try to correct it. I think the untrue facts going around on coronavirus are simply very discouraging. But you see there's not that much difference between what CDC says when they're not being muzzled, and what Johns Hopkins says, and what Harvard says, so that there's agreement among the scientists about what to do. It's the politicians who are saying that this is not true. And, you know, a couple of years ago, I was homeschooling my granddaughter, and we were figuring out that she was smarter about climate change than a typical politician from Oklahoma. And even when we took the politician from Oklahoma who was a scientist who didn't believe in climate change. And here, a child student could figure that out without any problem. So the scientists will not always be right. They'll make mistakes, but it's self-correcting, and that's the point. You remember back in the days of AIDS, when it was early on and we first were able to isolate a virus. And then there was a dispute. Who isolated the virus first? Was it the researchers in France, or was it Dr. Gallo at NIH? They both claimed they had done this. A virologist came to me and he said, what do? We know that Gallo took this virus from the French scientists and then produced it as if it was his own. I went to my boss and said, what do we do? And he said, you don't have to do anything because science will be self-correcting. And when the Nobel Prize came out for that, it went to the French. Not jointly to the French and the Americans, it was sorted out. So eventually the science does get sorted out. But in the short term, we can't wait for eventually when it comes to coronavirus. This is the worst public health problem that we've experienced in our lifetime. And it takes everybody to try to change it. And it requires the government to come out with truth. I just published a paper last week that I wrote 4 months ago, and the National Academy of Medicine almost decided not to have me co-chair the committee because I was so upfront with this article. What I say in the article is, over the years, 75 years, we've learned so many lessons about how to control outbreaks of infectious diseases. The US government is now violating every one of those things we learned. The first one is know the truth. You cannot contain an infectious disease outbreak unless you know the truth. And we can't find truth. And I say in the article, so what do? We have to go to universities for the truth rather than CDC, where we've always gone in the past for the truth. And CDC has been not just muzzled, but the administration has been willing to put things on their website as if CDC was saying them. I mean, it's really a corruption of science. It'll get sorted out, but in the short run, it just causes more problems than one can imagine. But I should also say on the other lessons, I'm not going to go through them, but one of them is you require coalitions. Number 3, you have to have a national plan. You can't leave this to 50 states to figure out on their own. They become competitive. They increase the costs of all the things that are needed. We say you have to approach this in a global fashion. It's just absolutely important to have WHO and so forth. Every lesson learned has been violated. And here we are in the worst public health problem we've had in our lifetime. And I said, we're absolutely humiliated. We have to just apologize to the public and apologize to the world that we did not use our knowledge in order to contain this outbreak. And it bothers me more than I can tell you. It bothers me because of the people dying. It bothers me because of this outbreak, which could be contained. I'll give you just one other example. If you look at contact tracing, and over, people say it's too complicated to do contact tracing. We just don't have the ability. There are too many cases and so forth. When I was working on smallpox in India in 1974, in May, in just a single state, we were having 1,500 new cases of smallpox every day, which meant 1,500 new investigations every day with contact tracing. Going back to see where did they get the virus, who have they been in contact with since they have been exposed themselves. And we did that. We did that before smartphones, before computers. At one point, we had hired 100,000 people to act as watch guards on the houses of people that had smallpox. Now, if we could do this without the technology of today in India, there's no reason you shouldn't be able to do this in the United States with all of the technology that we have. And so it's just been a inability to face up to what the problem is and how to solve it. And all of these tests that have been done by the millions, and how many of them are useless because the results come back too late to do anything. You can't do contact tracing a week later and have it mean anything. You have to get results right away and start the contact tracing immediately. Well, I'm venting more than I should.
I'm going to go to Leslie Sandberg, and Leslie has a question.
I also join in thanking you, Dr. Foege. This hour is going so fast. And fortunately, we can vote very soon. My question had to do with what you were saying at the very beginning, and I'm not sure if I misheard. I think you said, even though we will have a vaccine, we'll still need to wear masks and social distance. Did you say that, or did I just?
I did, because the vaccine will simply be a tool, and even if it's 70% effective, 30% will not be protected, but they won't know that. You won't know which 30% are unprotected. So you have to just assume that you're still susceptible and wear a mask to protect everyone else.
For forever, for long term.
Well, it won't be forever. And this is another thing. You hear Dr. Atlas from the White House has been promoting the idea of herd immunity. When I became involved in smallpox, the experts told us that with smallpox, herd immunity would be reached at 80% coverage. And we had a absolutely good vaccine. I mean, a vaccine that's good 98% of the time. So you should be able to get 80% coverage. India had used that approach of herd immunity for 150 years, and they had not been able to control smallpox. And world experts would go in each time and evaluate their program and say, well, you didn't actually reach 80%. When we do the assessment, it turns out that the vaccinators would turn in records showing they'd reached 80%, but they were actually going back to the easy to reach children 2 and 3 times in order to get up to what looked like 80%. The last global expert group that went to India and came up with a recommendation, I couldn't believe it. They said, you've not been able to reach 80%, and that's your problem. And so your goal should now be to reach 100%. And I say to myself, if a country can't reach 80%, what good does it do to say, well, you should now reach 100%? So we went to India and we used a new strategy where we went right for the virus. We became so good we could tell where the virus was, and all we did was vaccinate around the virus. And we went from what I was saying, 1,500 new cases a day in a single state. We went from that to 0 in the entire country in 12 months' time. I mean, think of that. India for 150 years had used herd immunity. So what's wrong with herd immunity? Well, it's just a figure. It's a number. And it tells you that your risk of getting a disease is less if 80% are immune as compared to 60%, but it doesn't give you any protection. And it depends on population density. So it's really how many susceptibles do you have per square mile rather than what percentage of the population is susceptible. And I used to say when I was working in Bihar state of India, in Patna, if we were able to vaccinate 80% of the people in Patna, we would still have more susceptibles per square mile than we would have in Seattle if no one was vaccinated. And so that's how ridiculous this herd immunity discussion can be. It depends on population density, but if you're going to try for herd immunity, it has to be with a vaccine, not with the disease. You just, now in the United States, probably about 10% of people are immune to coronavirus. It's higher in places like New York, where it's 20 to 25%. But to go from 10% to whatever figure people want to use, 80%, think of how many more people would have to die just to get up to that number. Herd immunity is a useless concept to use on this epidemic.
I'm going to go to Steve Salburn.
So Dr. Foege, if herd immunity is not helpful, what about herd mentality?
They're probably about the same value.
Sorry, I had to mute myself on that one. Do we have other questions for Dr. Foege? Laura.
Dr. Foege, this may be coming outside your area of expertise.
Almost everything is, yeah.
But what and how long do you think it will take, assuming a change of administration in January, to repair the reputation and the credibility of the CDC and the FDA and associated institutions?
That's a sad question, because one of the problems I see in the administration is they've had problems hiring the very best. And that's why we have people like Dr. Atlas coming up with herd immunity. And the same thing is going to happen at CDC, that people are demoralized, and I still keep in contact with people there. They're demoralized, they're working hard. I can tell you this, if you get below the political layer, they're working just as hard at CDC as they ever have, but they're demoralized and they feel they're not being protected. And so CDC is going to have problems for some years in hiring the very best. Up until now, they've never had that trouble. And I used to be just absolutely amazed at the quality of people. And I would go around sometimes and ask people, why are you working here? I mean, you know what you could make with industry or outside. And the answer was invariably, we can do things here that we can't do anyplace else. You can come up with a national surveillance system. You can do things that aren't possible elsewhere. It's going to take a while to be able to get the very best there again. And it hurts me more than I can tell you, because CDC, I became interested in global health at an early age. I was in a body cast and in a town with no television. And so I had to read. I mean, what else could you do? And so I did a lot of reading. I became interested in Albert Schweitzer and what he was able to do in Africa. And as a teenager, I was already getting some of the first publications from CDC and from WHO. And I can't even tell you now how I managed to do that, but I did, because that's how deep my interest was in both medicine and Africa. And so I went to medical school at the University of Washington, and there was almost no one interested in global health. It was amazing. I couldn't find 3 people in the whole faculty. I found one. His name was Ray Ravenholt, and he said to me, if you're really interested in global health, he said, there is no track. You have to make your own way. But he said, go to CDC in Atlanta, become part of the Epidemic Intelligence Service. You'll meet people who will be your colleagues the rest of your life because they're interested in global health. Such good advice. 2 years ago, maybe 3 years ago, Bill Gates invited me back for their annual meeting. And he had a session for 30 minutes of just interviewing me, asking me questions. And when we got to the question of mentors, I said to him that this is one of the most crucial things to try to get in the education system. The two best indicators of how children will do after they graduate. Number one, did they have a mentor? Number two, did they have a chance to use their new skills under supervision before they left school? So I said, mentors just turn out to be very important. And I said, here I was in this town 60 years ago, and I found a mentor. He said, go to Atlanta. I said, he ended up working around the world on family planning and then came back to Seattle to retire. And so I said, it's amazing. He's here in Seattle, retired at the age of 93. I said, what's even more amazing, he's in the audience. And with that, he stood up and the spotlight went on him. He got a very long ovation. And that's how important mentors are in getting people to go to the right place because of their interest. And I already had an interest, and that's what helped me.
Any other questions for Dr. Foege? We have time for about one more.
Let me just add, I had breakfast with Ravenholt the first week of March, just as this whole thing was started in Seattle. And so now he's going downhill very fast, but I still talked to him a week ago.
All right. Well, thank you so much, Dr. Foege. Thank you for your time. Thank you for your expertise. Thank you for all of your work and being willing to share that with a bunch of Iowans. And thank you to your cousin, Ro Foege, who invited you on our behalf. We are so appreciative of everything that you're doing to try and make everything a little bit safer for everyone. Appreciate that. For those who are watching, yes, absolutely. Everybody clap. The virtual clap.
Thank you. Thank you. It was my pleasure being here. And let me tell you just one short story of, I told you there were only 2 other people in my class in grade school in El Dorado. And I've talked to both of them in the last week. And one of them I called, his name is Buddy Vox. And I just came across by chance in the internet a picture of him graduating from vet school in Iowa, receiving an award for being first in his class. And I noticed that it said that he got this award from Dean Merchant. And so I once had a person by the name of Jim Merchant working for me, who was from Iowa and came back to Iowa and became Dean of the School of Public Health. And I asked Ro for his email address and I got hold of Jim Merchant and found out, sure enough, that was his dad. And so then I called Buddy Vox to tell him about this connection. And so he suggested I call Lauren Gross, the other person. So here we are, 3 people in our mid-80s and still able to talk to each other. So thank you very much for having me.
You're very welcome. That's awesome. To folks who are watching, next month, our Intersections, same format. We will be talking about the election because it will have just been 3 days before. So we have Professor Rachel Payne-Caulfield from Drake University who will be our presenter. So, and we'll figure out what the real topic is on the fly probably in those 3 days, depends on what the results are. So she'll talk about at the federal level, president and Congress, but also state legislature too. That is certainly in play. So in the meantime, be well, stay safe, and make sure that you vote. Early voting starts on Monday. So whatever that is, make sure you vote. Thank you all.
Thank you all.
Ro, thank you so much for inviting him.
Oh, well, I'm really pleased that we were able to pull this off and that Bill was able to join us today,
Yeah.
because he's a wealth of information. He's
Yeah.
like a huge library.
I feel like he gave it a little bit out of the tip of his finger, you know, like there's so much more. So anyway,
See,
thanks for doing that. Appreciate it. Take care.
glad we could pull it off. Thanks for doing it.
Yeah.
Thank you.
Okay. See y'all.
Bye.
Yeah, good to see your faces.